All right, welcome back. Well, a new center at the UW School of Medicine and Public Health seeks to examine how a person's environment and social conditions can impact their health. The new research effort is called the UW Center for Health Disparities Research. And Dr. Amy Kine, the center's director and professor of medicine, is here to talk with us about the new project. Thank you so much for joining us this afternoon. And the root of this study is to look at the disparities in the healthcare system. But tell us a little bit more about how this research came about and how it's being performed.
Absolutely. Thank you so much. The University of Wisconsin is deeply committed to not only examining health disparities, but to eliminating health disparities. And in our march to do so, it's important that we conduct research that truly gets to the root causes of why disparities happen and how they affect our bodies, how they affect the very cells within our individuals that lead to disease. And so this type of mechanistic health disparities research links cells to society and neurons to neighborhoods, and it opens the opportunity for better therapies, better precision medicine approaches, and even new social policy.
Yeah, and so you're looking at all those factors that a person experiences across their life and how it impacts their health. But going forward, what is the hope that you guys hope to accomplish from this research data?
Yeah, thanks for that question. Well, we recently were thrilled to get awarded a $28.5 million study that will place the University of Wisconsin at the forefront of this area. Our study will be looking at how individuals experience exposures across their life course from birth all the way to the present, and how this influences their risk for brain diseases, especially Alzheimer's disease. As you probably know, Alzheimer's has no cures right now, and the more we can learn about it, the more we can learn why it disproportionately impacts certain populations, the better chances we have for perhaps someday finding a cure. But this same type of approach could be applied to other types of diseases as well, like cancer and diabetes and heart disease. So we're really excited about learning more about these fundamental mechanisms and to really help us understand why certain populations experience worse health outcomes, and not just describe those differences, but get to the root cellular causes.
Yeah, very important research that's being done. And a centerpiece of the center is the Neighborhood Atlas, which you developed a couple years ago. Can you tell us a little bit more about that?
Absolutely. Thank you. The Neighborhood Atlas is a free democratization tool, data democratization tool, in which anyone can look at the relative disadvantage of any neighborhood across the full United States. It's been used now in health policy efforts, in health systems, the different ways they allocate clinical resources. It's been used in research, and it's even been used in community work, direct community work. So we are reaching nearly 500,000 hits at this point, and the Atlas data are available and accessible to everyone. So it's taking these very complex research metrics and making them available just like a map on a smartphone.
All right, Dr. Kine, thank you so much for your time this afternoon.